Good evening, ladies and gentlemen. Welcome to Atlantic Bushcraft Adventures. Tonight we are on episode 286. I think. I could be wrong on that. I actually have no idea. But in any case, tonight we are talking about first aid kits. What should be in them? What are some luxury items? How often should you check them? How big is too big? Hopefully we cover all this and much more here tonight. This is a topic that I absolutely enjoy, as you can tell by my enthusiasm. But actually, this was your suggestion, Ben. So why don't you walk us into what you want to cover in this, and I will follow suit.
Well, we have talked a bit about this in a previous episode, quite a ways back, though. It's been a while. And I just wanted to sort of say that because it is time for a reminder for people to, make sure you have one. Make sure that it's appropriate for the trip or the adventure you're planning on doing, and also to make sure that it's everything that in it is up to date and still relevant. Just like the rest of your kit, your first aid kit is going to vary season by season. Just an example, sunscreen, insect repellent, or treatment like anti-itch, like whatever. There's one, I have it in mind, I can't remember, it's insect bite or whatever.
Afterbite and Benadryl spray is the two that I usually look for.
So things like that. Is there things for the winter? Probably too. We'll probably get into that. But yeah, think about what season you're going into, what you're doing, what your activity is going to be. So yeah, we wanted to sort of get everyone thinking about their first aid kits. Maybe pull yours out and take a few minutes to go through it. And just, is it what I need? Is it to the level that I want it to be?
And I guess that's a good spot for interjecting into one of the things I wanted to talk about is not only let me snowball off, pull it out, and take a look. Because it is a good time of year for people to start checking their kits because we are doing a drastic change of the seasons. And believe it or not, some of your first aid stuff expires, and you should keep an eye on that. It's one of the big things that a lot of people forget about. They bought a first aid kit, they throw it in their bottom of their backpack, whatever, and then they never look at it again until they need it, which is kind of a first aid no-no. It's good to have something there, but you have no idea how good any of that stuff is in it. Even a simple Band-Aid or adhesive bandage or whatever you want to call it, the stickiness is only good for so long, and then it kind of goes to crap.
Yeah. And people have preferences on some of this stuff. And I think we need to break it down into a few levels or categories, I guess, is the thing. And one of them is definitely going to be consumables. So do realize that a lot of stuff in your kit is consumable. And if it's consumable, there's a good chance it has an expiry date. Right? So
absolutely.
Keep that in mind. But before we get into consumables, because I think those are going to take quite a while, one thing I would like to talk is the non-consumables or the tools. Because most times the non-consumables are more tools. They're not something that's going to get used up. It's something you will be able to reuse and be useful to you in the future. And there's three that come immediately to my mind, and I'll throw those out, and then I think you're going to have a few more. But right away, some kind of tweezers or cutting devices, and something to help you see, magnifying glasses and flashlights. And I have seen both of these things combined. I have a magnifying glass, or I have a tweezer with a light in it, and I have a magnifying glass with a light in it. So these are two good things. You have a multi-tool there.
Yep, so two different types of tweezers plus a cutting device. So you nailed the ones I'd normally carry on there.
Yeah. So my kits, I have found little multi-tools that I carry. I often just have a pair of scissors, a pair of tweezers on them, maybe a few other, maybe a file. Believe it or not, a file is useful for a lot of stuff in a kit. But these tools, you want something that's lightweight, that's not going to add to your kit, but is adding value. So think about it before you put it in. Am I just throwing it in there to have something else in my kit? That is not a good idea. But yeah, small multi-tools are a popular one for me. Decent pair of tweezers. You may have splinters you need to pull out. You may have like ticks that you want to pull off. Things like that. Or even an open wound, you want to clean it. Ooh,
so this is something that I've been starting to carry in mine as well, as one of these tick keys.
Tick key?
I haven't tried it on human yet, but on pets it works well.
We've had the tick forks same idea. That's usually in our kit, especially if we have pets. They're more prone to get them than people, but people do get them for sure. Um, so yeah, think about those things. These are the things that you are going to need. You will want some way to grip things. Make sure you keep these things clean, or have some kind of antiseptic that you can put on it and keep it clean. It's no good to take a pair of tweezers that are filthy, pull a splinter out, and end up with an infection where the splinter was because of the tools you used to remove it. Same thing with your cutting device. If you're cutting a Band-Aid or something and introducing dirt and bacteria, that's a pretty big deal. Sterilize them to the best of your ability and put them in a sealed bag. And I usually keep some alcohol or something that I can wipe them down with.
100 swabs, $2 at the dollar store. I mean, I just keep a bunch of these in all my first aid kits specifically for what Ben was saying there. Disinfect the tweezers, disinfect an area you're going to work on, or in a pinch, fire starter.
Another thing that they generally recommend, it comes and goes a little bit in need, a mask for mouth to mouth. If you take a first aid course, you'll get one with those. A lot of them are sealed. They do fall a bit on the consumable level. A lot of them are not overly reusable. I think that Robert's probably going to grab one.
Well, a couple different varieties. I have a little bigger one to give people an idea of what these things look like. Plus, I have the one that you are talking about that comes in a first aid kit, which is going to be the next one up.
I think one of mine is hanging within a few feet of me. Some of the better ones can be cleaned and reused, and some of the cheaper ones are essentially a piece of plastic.
All right, so this is the ones that normally come in your first aid kits for anybody that's joining us on video. And these are a one-way valve mask. Basically, this opens up into a sheet that's a little bigger than the bag you see here. And inside, there's a one-way valve so that you can breathe in here, but nothing can come back up through it, is the idea off it. That way, no contaminants or something like that's going to re-come back on you. A little better visual on that. And this one, I don't expect you to take in your normal day-to-day bag, but this is something I would throw in like a group first aid kit. I'm trying to get that out of there. And this is a pocket valve mask, which it's just a fancier version of what you've seen over there. And I don't want to take it out too much and get it all dirty, but same kind of deal there. Comes with a one-way valve, and that seals in there, and this will make a nice seal around somebody's face, nose, and mouth, and then you breathe in through this hole and nothing can come back up at you, kind of dealio.
Yeah, and I have a level that's probably somewhere between that, or maybe it's very similar. I have this one here, and you have the valve that can go on top of it. And yeah, you can inflate this lip, and it really helps. And then you get the really cheap ones, like you said, the very minimal ones.
And they are better than nothing. Don't get me wrong, but they are very limited as well.
But what do you have room to take, and who are you going? If you're going with friends and family and people that you more or less trust, maybe you don't care so much for the mask. But then if it's a complete stranger you come across in the woods, you may really wish to have it because you don't know who they are and where they've been and what they may have, and you don't want to risk causing a problem for yourself. So there's another tool that I just thought of as we were talking. Oh, gloves.
Yes, and those are in my pocket valve mask there too, well, in all my first aid kits. But some disposable gloves, absolutely.
Again, same thing, keep them clean both for yourself and anyone you have to use it on. But if somebody is wounded, there could be bodily fluids and other things that you want to keep away from yourself and them. Gloves will help protect both of you. So those are, I think that covers us for tools. I mean,
the only thing I might include in there, but you could also find it in a standard first aid kit triangle, is going to be some safety pins. Just in case you have to pin something together. Like, not only necessarily for first aid, but just if you simply have a button or something that breaks, they're a handy thing to throw in a first aid kit, along with maybe a small sewing kit, like a needle and some thread at the very minimum, or non-flavored dental floss is a big fan favorite of mine.
Now, when we get into band-aids and different methods, there's other tools that we can use for some of the purposes of that. We can talk about that. I did want to throw out one tool that I personally am hesitant to take. I know a lot of people, especially medical people, do take, and that's a tourniquet.
So tourniquets, for what they were worth, and I'm sure this is where you're going to there, Ben, for a long time, they were in medical first response or emergency first response, and then they were out of emergency first response because there was some debate on them, and if they are not used correctly, they can cause some damage. Not to mention, you have to be sure how to use one to actually be effective, and this is the two big things that they found was people were using them incorrectly and causing some issues, or not. Both instances, they're using them incorrectly. One, they're either sealing things off way too good in the wrong place, or two, they're not sealing them off effectively enough.
Personally, I mean, I could see myself using one in a dire emergency, but at that point, for me, they're in risk of losing their entire life because they're going to bleed out if you don't use it. If you shut the blood off to an area for over a certain length of time, there's blood poisons that can build up, and by removing the tourniquet, that can end their lives as that bad blood now comes back into the body, and it must be done by a medical professional in a controlled environment at that point. So if you're going to put a tourniquet in, know that you better know what you're doing and make a good decision on that. Personally, I'm going to avoid it as much as possible. I will leave it for somebody who I think is more knowledgeable and confident than I am. And so that is my personal opinion on it. If you're taking a tourniquet, do take the time to understand what a tourniquet is and how it is used, and then make the judgment of whether you think it's really appropriate. If you don't have a tourniquet and you actually need it one, there is plenty of ways to improvise one. It doesn't take a lot. So you can make a tourniquet pretty easily in the woods with not much more than a piece of string and a stick. Take that for what it's worth. I am not recommending it, but it is a tool that some people will want, so I threw it out there.
No, 100%. And we have some, and I'm not touching that with a 10-foot pole, to be honest with you. I'm just going to leave it at the facts I gave, and like you said, people can decide what they want to do. And much like you, if you decide it is a yes for you, be sure you know how to use it, and that doesn't mean necessarily just a YouTube video. Actually buy a tourniquet, take a look at it, and make sure it functions the way you think it should function. Anyway,
I have the 10-foot pole.
So we have a couple comments over here. We have Danny and Steve joining us, much like they do. So, Steve, I put some pills in my kit. Sucks having to leave the woods because of a headache that could have been easily cured with a couple Advil or Tylenol. Only happened to me once, won't happen again. Danny, EpiPen, maybe some Benadryl. And this kind of comes under consumables. And I think we're both going to talk about these here in a little bit anyway. But I just want to let you guys know we did see it. We're getting there.
Yes, that's a very good point. And so there's a few things that I like to see in my kit. Some of them are very benign. Some of them are a little bit more important to keep in mind. One, for me, aspirin. I mean, there's Advil and Tylenol, other painkillers you can take. Aspirin is my choice. It's because if somebody is experiencing some of the symptoms of a heart attack, it can be useful to help prevent that. A stroke is also on that level because it's a blood thinner, and it may help with that. And it's pretty safe to administer, so even if you don't have a lot of medical background, an aspirin is a pretty safe thing for most people. I think there is a warning on using it with kids.
Yes, you can get baby aspirin or junior aspirin.
Yeah. So just be aware of that if you are going to be using it. It does have a negative effect on some children. Be aware of that, and that's about all you really need to know with that particular idea. The other one I carry is Tums, antacids, and Pepto-Bismol now, I think I might even have one here close. They have a pill version that
Hmm.
I will now throw in my kit because there's nothing worse than some kind of like diarrhea while you're in the woods, especially, you may have limited ability to deal with that. You're not taking like a ton of rolls of toilet paper and all that. So it's not where you want to have that. So that's there. And anti-itch, like we mentioned, afterbite, right?
Yep. So, my medical kit. I have a pill case, and I carry a couple different things of different substances in here. So, I'm not going to give any brand names. I'll let you folks use your imaginations and whatever best suits for you. But some of these are going to copy over Ben, so I'll cover them first. I have some sort of anti-allergen or anti-itch, like Benadryl in this instance. I said I wasn't going to give brand names, but people know Benadryl for what it is versus the scientific name more specifically. So, other than that, I have actual anti-allergy medicine for like seasonal allergies. I have my medications, spares of my medications, such as my like you said Tums, but I actually take a GERD medication. What you looking for, Mel? Oh. Then there's some pain medications. Then I got pills to make you start pooping. I got pills to make you stop pooping. I don't actually do a lot of the afterbite for whatever reason. I always wanted to, and I just never made it into our kit. We took it once for Lily, and yeah, it just never seemed to really work for us. So I don't know if we're using it correctly, to be perfectly honest. But other than that, big things, like I said, is any personal medications, make sure you have a couple days plus, so however long you're going to go out there, plus a couple days extra just in case. It's good to divide those up sometimes and keep 2 extra caches in case you lose one. I tend to divide it between a little just, and this is going to be terrible, I can hear people saying it anyway. I take an old Tylenol bottle and I'll drop a couple of each one of my medications in there, and then at least I carry that in my pocket. And if it all goes to heck, at least I have that. Yeah, they're all jumbled together, but I know what my pills are, and I know how to separate them. I wouldn't want anyone else to administer them to me. But then I keep them actually separated in here. And generally, I do label my first aid kits a little bit so people know what they're looking for. But yeah, there's all kinds of other stuff that you may want to keep in there too. Just trying to bring it up on here. I actually had a little bit of a list.
Anti-burn cream.
Yes, burn gel. So here's the ones we had listed off, and this is much like the site you gave there. Pain relief, antihistamine, anti-itch, anti-sting, anti-diarrhea or a laxative, antacid, allergy, nasal decongestants, EpiPen, like what was mentioned there. Something else I carry that's going to be a little weird for people is not a laxative, but a stool softener. So sometimes they're going to help you. And when they do, you will never leave home without them again, is all I'm going to say. But these are all like intestinal things that you can fix very simply with some pills if you have them on you. If you do not, it makes your outing very, very poor.
Yeah. And honestly, like if you're doing a 1 or 2 day trip, so you're a day out at some point or more, if you get a bad bout of diarrhea or you get a bad bout of allergies even, those things can make you absolutely miserable. Now, I personally avoid anti-allergy medicine because I have a theory that it makes me sick. I've pretty well proven it. So if I can at all do without it, I avoid taking that. But that's a personal thing on my point. If it works for you, by all means use it. It just doesn't work for everyone. And I think that's what I want to point out. Look at the group you're going with. Is there medicines they regularly use or like or need? And have those available. It doesn't take long to ask everyone, what medicines do you often keep in your cabinet? And then take a sampling of those. Muscle relaxants were one.
That's what Mel literally just said. She walked by and said it just as you said it. It was eerie.
Yeah. Muscle relaxants is one that was not used on a trip I was recently at, and that's something that they were very glad to have. Things like A535 or Bengay or Icy Heat or whatever, any of those. When I was in the military doing a lot of training, there was a few days that without those things, I don't know if I would have made it through the next day. So that'll help. And if you have sleeping problems, maybe some sleeping pills. Be careful with all these. Make sure that you're using them appropriately and correctly. And don't try these out the first time in the woods. I can't emphasize that enough. If it's an unfamiliar medication, be very careful because you don't know how you will react to it, and it may not have the effect you hoped. So it's best to go with tried and proven ones for yourself.
And if you have the choice, the non-drowsy ones are typically your better bet because you don't want to be drowsy, dopey, and dizzy wandering through the woods, if you can all help it.
You don't want to be the seven dwarfs.
But yeah, so medications, a good selection, like Ben said, of the common things that you'd normally find in your medicine cabinet isn't going to be a bad deal. But just be sure, if you're able to, label them. That way, if somebody comes across you, they don't start feeding you some generic brand of painkillers thinking it's some sort of medication you might actually need, like a nitroglycerin pill or something like that. You know what I mean? Make sure it's labeled.
Well, and I'm a personal believer in never taking someone else's prescription drugs, but I have been in the woods and I've been at work and I've been in other places where someone will pull out their prescription glove and say, take this for that problem, it'll fix you right up. And I'm like, absolutely not. Your name is on the bottle, I'm not touching.
Well, there is other side effects that come with prescription pills too. Yeah, it may do exactly what you want, but maybe only in their use. And like Mel just said, what else have you had today that you don't know if it's going to interact with that?
It works fine with my pills. Doesn't even make it work fine with your daily pill.
So my theory is I am not a doctor. I'm not making medical calls beyond what I'm comfortable with. And as a fairly limited thing, there are drugs that I am used to and I will take. And I'll keep some of those with me. There's some other ones. If you have like a flu-like symptoms, some of those the Sudafed drink mixes might be worth taking a couple of those, packs of those too, if you want. Halls or
cough drops
whatever.
and throat lozenges. Yeah, I usually have a pack of Halls sitting in my my bag too. I completely forgot about that. Good call.
Non-medical, high sugar candy.
Yep. Works good for a boost of energy, and if you come across somebody that is any kind of diabetic one way or the other, administering sugar is far better than trying to figure out insulin. When in doubt, administer sugar is generally what they tell you, because it's not going to make anything worse to any extreme. But if you try to administer insulin, you have no idea what you're doing. You could potentially kill someone.
Yeah. So it's worth having a bit of that in there. Like you said, it's an energy boost. If you're absolutely cold or exhausted, taking a bit of sugar might help you out. And if it's somebody, you come across somebody in a diabetic situation, you can give them that. Another item that I often keep in mind is some kind of electrolyte.
Mm-hmm.
And I'm sure you have a tube of them there.
I was going to say, I should have some within arm's reach somewhere.
Yeah. If you've been hiking and doing a lot of work and sweating a lot and you're absolutely exhausted, you may very well could be low on electrolytes. Also, if you've gotten sick and had to use the washroom a lot, those can get depleted pretty quickly. And that is a dangerous condition. And some electrolytes, yep, right there.
I keep forgetting my ring light shines on everything so bad. There we go.
I can't see it. But yeah, they're cheap, relatively cheap and easy. Don't take up a ton of room. The ones I have is in a tube. They're like pills. You throw 2 in a bottle of water.
Yep.
And with muscle cramps, I have found them to be lifesavers. That or just even a bit of salt will help me. So something to keep in mind, right? Some kind of electrolyte. Is that covering medicine pretty good? Because we can get the wound care next, I think.
I think that's a good place to go.
So, absolutely, I'm going to attack this at a certain order.
Goes back in the bathroom.
And first off, you need to keep wounds clean. So some kind of cleaning. Yes.
The alcohol pads again. They sting like a bugger, but they work.
You can get iodine pads. You can get a few other things. It used to be super common. Hydrogen peroxide. Medical field has kind of shied away from that, but
antiseptic towel.
Yeah. But whatever you choose, be familiar with it and its risks and stuff. I've often carried a little bit of alcohol. The beauty is it can help start a fire. and it's pretty good. Like it's pretty safe. So yeah, small bottle of alcohol could be used as a fire starter. Can be used to clean a wound, flush something out. It's not a bad idea. Band-aids, you definitely want a variety of them.
I'm just looking at the ones I got here. These are just a couple of the common ones I usually pack in my bags because they're the knuckle type and
Yeah.
joint type. I find like I bring more than these than any of the regular strip ones because this will usually work in the place of a strip one, but it'll also give you that, mobility of a knuckle or bendable one.
The very important, and we're talking cuts, scrapes. If it's a kid, maybe a bruise, but anytime the skin has been damaged, blisters. Once you get a blister, covering a blister with something like that can help prevent it from getting any worse. Do know you should never burst a blister in the field. I'm not going to get too far into that one, but just
If you have the room for it, this stuff's pretty good.
what's
This is
that?
an actual emergency first aid spray wash.
Yeah.
It's antiseptic. It can be used for skin and eyes, is why I like this one. It's a very low stream, and there's a little adapter where you can actually use this as an eye flush. But once again, it's a pretty big can that takes up a fair amount of room. If I was going group camping, yeah, this goes with my pocket mask. Otherwise, I generally don't take this. But if you got the room, it's not a bad thing.
But I guess more technically a true Band-Aid, because what we're talking is more like the Band-Aid brand, or it has the gauze, it has the adhesive, and it's a really good solution. It's honestly, I always have a ton in my kit. But some kind of tape, medical tape, and gauze that you can put down, it's also really important.
And once again, I believe this came from the dollar store. But it is cloth tape and an entire box of it because I have a lot of first aid kits that I stock up. And it just pop one out. Good old medical tape along with some of those bandages, just as Ben was saying. Sorry, I'm trying to hold up demos as you're talking.
I try to keep polysporin, but there's triple ointment, antibiotic ointment is listed on this page that we're using as a reference to make sure we don't miss anything. Some kind of medical cream that'll help keep a wound clean and fresh that you put under the Band-Aid, more so than the alcohol that you use for the initial cleaning. So this is a longer term thing. Skin closures. So we talked a little bit about a sewing kit, and some people are going to immediately go to, oh, I can just sew my wound up. And
Harder than you
absolutely-
think. From experience,
Absolutely.
harder than you think.
That is a possibility, but there are some really good Steri-Strip systems out there right now. Some of them have almost a zip-like effect where you put it on either side of the wound and you just pull them tight. Butterfly-type Band-Aids. There are plenty of methods out there now that don't involve you having to sew yourself up.
3M
I
Steri
highly-
strips. Stitch tape, basically. Works great.
I recommend doing in a pinch. You can do something very similar with things like duct tape. This is more of an emergency thing. I do recommend maybe a small roll of duct tape in your kit for other reasons. Crazy glue.
Crazy glue works rather well,
Yeah.
honestly.
Yeah.
I mean, it's
And
a go-to for a lot of people for a reason. Do I recommend it over stitches? Absolutely not. Has it gotten me out of a couple, no pun intended, sticky situations? Yes.
It works really good if your skin is slightly damp, and if you're not very careful, you may attach other things to the wound that you didn't intend to, or just your fingers to themselves and make it difficult to continue working, and you'll have to sort of tear that apart. It is effective, and you can close a wound short term with those. There's a degree of risk with that. The triangle Band-Aid was hugely popular with first aid, St. John's Ambulance and stuff, but they've all gotten a bit away from that. But you can make a sling, you can help close up a bigger wound, like hold your gauze down with something like that. And if you sprain or something, some kind of tape that you can wrap around or God, what is it? Yeah. The expanding material. I always have some of that around me too. I have injured wrists, knees, elbows, ankles. Any joint has that risk. Yeah. You can also get splints, foldable, usable splints. If you have enough room, they do take up a bit of room. Yeah. And you can get them big ones, small ones for fingers, one for arms, up to full leg.
Yeah, and they're called soft splints. Or Johnny splints? I can't remember what they were called now. I just had to buy a bunch for the fire department. There's the finger ones for anybody that's interested. No, I do not carry these in my backpacking pack, like my first aid kit that's in my backpack. But I do have a couple in the ones that I generally carry in my truck, which we'll talk about in a minute.
If you're camping, your chances are you have some blankets and stuff, but an emergency blanket never goes astray. If someone gets injured, almost regardless of the degree of injury, shock is a real possibility. And in shock, that is its own medical problem. And the best way to treat a shock is, of course, to treat the cause. But in the meantime, you still have to deal with the shock symptoms. So keeping them warm and comfortable really helps. So cover them in a blanket, a jacket. An emergency blanket is really helpful. And the beauty of these things is they weigh virtually nothing and take up very little room. So throwing one or two in your kit is not a bad idea. And in a bigger emergency where you're just trapped, it can be used as a shelter, or at least to enhance a shelter that you have built. The other thing enlisted in here was fire starter. We mentioned that with the alcohol, but a set of matches, some way to start a fire. Again, comfort and all that is important. I recommend a Bic lighter.
I was going to say, I will be horribly disappointed if I open this and Mel doesn't have a fire method in here. I see a ferro rod. I see bliss sticks. Flashlight. Also not a bad thing to have in a first aid kit.
Nope.
Medications. Well, all she has is a ferro rod. I'm surprised.
So, ferro rods are awesome. Don't get me wrong. In an emergency situation, you're trying to get a fire. If you haven't practiced with one, that may not be your best method.
Especially if you're on limited mobility. I think she has a windproof lighter, much like my kit does. She must just have moved it somewhere else for the time being, but I got one of these. Which is just a windproof lighter.
Yep. Honestly, like one thing that I thought is, and I know you're gonna love this.
Aha!
We mentioned a light. A light. These little water lights wouldn't be a bad option. You don't have to worry about the battery going bad in them. That's one of the things you're going to want to check when you check your kit. If you have anything with batteries in it, flashlights are the most common ones. But I have tweezers with a light on, which is really helpful when you're trying to find something. You turn the light on, you can really point at it and help get that splinter out or move that bug in the night. You have to check the batteries, and chances are you should have spare batteries. So if you have something that gives you light and doesn't need batteries per se, that's a great method. And last but not least, for me, some way of communicating outside, sending a message, and that's a wide breadth. It could be a signaling mare, it could be an inReach device, or a Solo, or no Solo, was it Zelio? Any of these?
Yeah, Zulus, whatever they are, yeah.
The new iPhones and the Motorola's have built-in emergency things where you can send a satellite message. Make sure you have a way of reaching out. If in some areas a small two-way radio is a lifesaver. Search and rescue come looking for you. They'll often be able to look up a signal. So if you're transmitting on something, you may get hold of someone. Yeah.
Just trying to make sure I get the actual right pill containers back to the right first aid kits because I had too much stuff open here. Sorry.
We are going over, and I think we've talked quite a bit about this. We definitely haven't rambled as much as we normally do.
Well, the last thing I wanted to go over before we leave, if that's cool, is
Yeah.
different
No.
sizes of first aid kits.
Yep.
Because it was one of the last things I did want to bring up here, because that's the question I get all the time is, how big of a first aid kit should I have? And first and foremost, there is no good answer to that, because it's going to be as big as you need it to be. And I have examples of different first aid kits that I use here, like my personal ones, and that's kind of what I've been digging all these parts out of, frantically trying to put them back in order. So for instance, Melissa's, which specializes in bandage wraps for her ankles because she has a bad ankle, has things specific to her. She has pills specific to her in here. But I mean, this is hers. This is her day. Like, this is what goes in her backpack. This is what she has. Mine, on the other hand, it's once again still putting parts back. Sorry, folks. Get back in there. Okay, mine's a slight bit bigger, but not a whole lot. You know what I mean? Hers is thicker, mine is just wider, so this is roughly pack size is what I would call this. And this has the one-way valve in it, the cheap ones that we were talking about, so if I need to do first aid, it's got my pills, that lighter, all the good stuff that we've talked about to a minimum amount. So my idea with this pack here is this goes in my kit bag, my backpack, and I check it before I go out every time. Is there anything I specifically need for this outing that I may not have needed for my last one? Is there something I can take out, something that's going to mean more to me? And that would go in here. So that's my pack one. My pack one's meant to get me to the vehicle I'm taking in. So generally, even if I'm walking in the woods, I've taken a vehicle to some place to enter those woods. And it could be my motorcycle, ATV, car, or truck. And I kind of rate my first aid kits based on those vehicles. And this is going to seem a little silly, but, for instance, my ATV one is a standard, vehicle kit. My car one is a Nova Scotia Class 2, and my truck one's a Nova Scotia Class 3. Reason being, depending on the vehicle I'm taking, the further I am going into the woods. So the car is kind of like I'm parked at a road and I'm walking in. So I got a good one that'll stabilize me, but then I can generally get help to come to me. The ATV, my pack one might get me to the ATV, which has a little bit more, and generally if I take the ATV, I took my truck, and then when I get to the truck, I basically have everything you could possibly want. But this is a big kit. I am not carrying this with me in the woods. It's absolutely outrageous. It takes way too much room, it's way too heavy, but in the truck it makes sense. And as you can see, I can join all these things up like that. So depending on how far in the woods I'm going and what vehicle I take, I get a different first aid kit for each one of those.
So I think the answer to what size of a kit, and this is my personal opinion, the largest kit you can reasonably carry for the trip you're doing.
Absolutely.
If you're doing a multi-day, say like I did a little while ago, a 6-day canoe trip with 3 or 4 people, we would take a slightly larger kit than if I'm doing a day walk. Now, does that mean I wouldn't need everything I could? Because I could get seriously injured in a day walk, but I can't really carry everything all the time. So I take what I think I'll probably need based on the expected events and the possibilities. You have to do a bit of a risk assessment. I am doing this, what could happen, and then what can I do to prepare for that? And that's what you're going to do. Everyone probably should have a very minor personal kit when you go, and then as the trip increases, you add to that potential. So if you're carrying a 50-liter pack or a 70-liter pack, having, say, maybe a liter of it dedicated to first aid doesn't seem unreasonable. But I can't carry that big truck one in my motorcycle. I will go to the same places you would go. Yes, we have both of those.
Yep. So this now became my little boat one.
Yeah. So it really does help that every mode of transportation you're going to have, you've developed a little kit that you can leave with that particular transportation. So your vehicles, your canoes, your kayaks, your bicycles, your motorcycles are all good ones. Day packs are a good one. And even then, if you're just out for a walk, something that you can probably put in your pocket or on your belt, and it's just going to help you out, right?
Absolutely. And the last one I was going to throw out there is something like this. This was what Mel carried in her car for ages, and I think it still sits under with the spare seat. It's a basic survival slash first aid kit. And this is just for those random times when she's driving around and you never know what could actually happen. This isn't planning to go into the woods. This is kind of like your day-to-day stuff. And you can combine it all into a water bottle, and it was a great idea. It's sealed, so I don't really want to open it because the outside of it's dirty. The inside of it should still be clean, ideally, here. But, I mean, you get the only thing I would have liked to have seen was a steel container. If I have to gripe, the only thing I'd like to have seen was a steel container, because then you could use it to boil. But it's a plastic container, and you can use that to boil in a severe pinch. But
with the plastic, at least you can see into it and kind of get an idea of what's in it without having to open
exactly. So I know why they went this way. But I mean, in this little kit here, it comes with Band-Aids, an emergency blanket, some matches, a little multi-tool, like a little Swiss Army knife, actually, a fairly good one, emergency candle, and some other odds and sods in here, which is kind of really nice. I mean, it's everything you could need in an emergency. You know what I mean?
Yeah, and I think an emergency candle is actually a really good point.
Well, yeah, a good and I think we've talked about this before. A good emergency candle, as long as you crack a window in your car to let out carbon dioxide, will actually keep you fairly warm.
An emergency candle stuck in a bit of tinder will get a fire going when nothing else will.
Absolutely.
Because it'll burn a lot of. So it's light, it's heat, it's potentially more heat. That heat could be used in a pinch to help sterilize something if you absolutely need it to. So you can use it for a lot of stuff. The two things I really want everyone to leave with is anything you take in the kit, know how to use it.
Absolutely. If it's no good to you, if you don't know what it does.
Yeah,
if I was to hand you a pulse oximeter like this and say, here, go do something with that. If you don't know what it does, it's absolutely useless to you.
Yeah. So if you're going to take something, make sure you know how to use it. Otherwise, you're just carrying weight for no apparent reason. And it's no good if you don't have the kit itself. So if it's better to go with a kit that doesn't have as much stuff as you'd like than no kit at all. So do keep that in mind. You know, something is better than nothing. And you're never going to have everything you want. You can't pull a hospital behind you. Take that few minutes to do a risk assessment. What could happen? What may not happen? And make the decision. I'm just looking at something I have here. Foot powder. You know, if you're doing a 4 or 5 day trip and you're worried about your feet, something like that's a great thing. Is that what you're going to have in every kit? No. You have one, don't you?
Nope. This is called Body Glide. This is actually anti-blister and chafing. So if you get like that chafing between your legs or anywhere that your body moves because it's damp or whatever, you're getting blisters, this thing here is literally designed just for that. I can't get it to focus in. But anyway, yeah, it's literally anti-blister and chafing, and it goes on just like pit stick, like deodorant.
I chafed the inside of my thighs one time so bad I wanted to cry.
Yep.
It may have been the worst pain I ever went in. A note, pain is exhausting.
Pain makes everything 4 times as hard and 10 times as long.
Yeah. If you are in a position where you end up in a lot of pain, you will not have the ability to do a lot of stuff you would think you could do. You won't be able to walk as far. You will need to stop and rest. It is debilitating. So anything you can do to prevent that pain, it helps. Don't get the blister. Use it could be cornstarch, or Astroglide or whatever it is called, like Body Glide. Do that stuff. But yeah. Anyways, that was the things I wanted to get through. Is there anything you missed?
Nope. I drug you back in and made you let me go over them. I'm good now.
Okay. But yeah, like I said, take a kit, do some thoughts. You will develop it. A good starting point are the pre-made kits. Go to any outdoor store or any place and they will sell you kits. Just be aware some of those have been on the shelf a bit longer than you might have expected. Check the expiry dates on a lot of these things. And oftentimes it's wrote on the outside when the shortest life item is. Make sure that it's still going to be good for 6 months to a year before you buy it. Don't buy something and get home and find out half of it should be thrown out. Then you're just rebuying a lot of stuff. But yeah, as a good starting point, a lot of these kits aren't too bad. Um, choose a reputable dealer. Just don't buy it on Temu or whatever.
Which you may get great options from Team U. I'm not bad mouthing them. That's not
could.
what we mean.
I
But
I'm
the
just-
first time around, get something quality that you can put your hands on.
I'm just not confident that you will always get it. So, it's something you don't necessarily need to cheap out on.
Absolutely, I agree 100%. I make sure I put hands on everything I buy. I very rarely order things online for my first aid kits. But that's just me.
We will for flashlights, for a lot
Oh
of
yeah,
other
for anything
things.
else. Absolutely. First aid kit, I like it to be pretty personal. I go to medical resupply places, same places I go to buy the stuff for the fire department, emergency services. It's where I buy the stuff for me.
So yeah, that's kind of it. There's a ton more you can add to these. That the sky's the limit. Determine your skill set and the type of trip you're planning on doing, and try to plan accordingly. You can't cover every situation, but you can cover a lot of them. So think about what could go wrong and then deal with that the best you can, right?
Agreed. I think that's all I got for us tonight.
Awesome. I hope you enjoyed this episode of Atlantic Bushcraft Adventures, and I will let you do the close because you're better at it than I am.
Fair enough. So, yeah, that wraps us up here tonight. As always, if you have any questions for us, comments, concerns, or otherwise, you can reach out to us on any of our social media, most of which is listed down here. Yes, somebody has pointed out that Google Podcasts is gone. It's now YouTube Music. Someday I will update that, but I'm going to be honest with you. I had to learn how to do it the first time, and it's been so long, I'm going to have to reteach myself to do it the second time. So I will get there. But anyway, yeah, you can still reach out to us on any social media. Shoot us a message. Shoot us an email. If it's an email, we do get to them. I apologize if it gets picked up by the spam folder. I have found the occasional one in there. We are getting to them. However, I kind of completely screwed up, and I wanted to bring this back in case the fellas listening. We had a request for tonight's show, but we also had the first aid thing backed up. So next week, Ben, if you're interested, there is somebody that is looking to get recipes we use in the woods.
Yeah, okay, we can do that.
So there's next week's episode, folks.
There has been a suggestion too for us to start reviewing dehydrated meals.
Funny enough, I'm working on a series of videos with dehydrated MREs.
We will talk after because there's a few things you need to know.
Okay, fair enough.
Night all.